Welcome to the AUA News Inside Tract podcast. Today's Inside Tract podcast is part of the Voices series, which is brought to you by the Diversity, Equity, and Inclusion Committee. Here we'll be joined in conversation with committee members, AUA members, and urologists from around the world to discuss how to build a strong, vibrant, and diverse urological community.
Thank you for listening to Voices. I'm Dr. Lourdes Guerrios Rivera, urologist at the VA Caribbean Healthcare System, San Juan, Puerto Rico, and assistant professor of surgery at the University of Puerto Rico School of Medicine. And I'm joined by Dr. Jimena Cubillos, pediatric urology specialist at the University of Rochester Medical Center, and Dr. Gabriela Gonzalez, resident physician at the University of California, Davis. Today, we are going to be talking about our shared experiences as a Hispanic Latinx in women in urology as we wrap up Hispanic Heritage Month. Dr. Cubillos and Dr. Gonzalez, thank you for joining us.
Oh, it's our pleasure. Thank you for having us.
Yeah, thank you.
I'm really thrilled to be part of this important discussion. You know, as we know, racial and ethnic diversity in the urological workforce is still lacking. So the percentage of urologists who are Hispanic or Latino has remained unchanged since AUA census, so from 2014 to 2020, from 4% to almost 3.8 in 2020. So these findings are also true for African American urologists. Therefore, as members of the AUA Diversity and Inclusion Committee, we want to highlight these findings during the Hispanic Heritage Month. So what challenges have you faced as an Hispanic urologist?
I have been very fortunate in that I've had very, very supportive people in my life, and both from my family standpoint and in the attendings that I worked with. I think probably has been the more difficult part is that you tend to be the only one, right? So where I did my residency, I was the only Hispanic person there in terms of in urology, and also one of few women in the residency program and even women in attending. So I think it's kind of sort of sometimes hard to kind of sort of share that experience. I'm an immigrant to the U.S. and most of the people that I worked with were born in the U.S. as well. So those challenges of growing up as being an immigrant are things that it's not a shared experience, but I've been very fortunate to be very supportive both with my family and with the attendees that I worked with. That said, I also chose programs that were known to be very open-minded. There's been programs in the past that had a reputation that was not as welcoming, so I purposely stayed away from that.
That sounds very important because you also selected your program according what the model that you receive. So if there was a program that there was not the culture for minorities, I think you wouldn't have selected the program. So it's part of the process. So I would say, Gabriela, that your perspective as a resident is also important. Is there any differences, as there difference in the number of applicants based on race that suggest disparities? So what's your thoughts and taking in account what just Jimena mentioned?
No, definitely. I mean, I think I've had similar experiences. A lot of things haven't changed. You know, my program for the past, 4 or 3 years, I was the only Latina in my program. So even now, right, it still occurs. I'm optimistic that the number of Hispanic residents and minority students applying to urology is increasing. The last match did have an increased number. I mean, it's still not as high as to match our patient population, but I think it is increasing. And there's still room for improvement. I think certainly in exposure to students that there are other Latino urologists in the community and can serve as role models and mentors. I think that's important as well. And as the DI committee has made efforts to promote urology to students from underserved backgrounds or from students who don't have a urology program, like at the last AUA meeting, I think it's so important to focus on retention once you start residency. We often are very happy, as we should be, when the numbers start improving and just matching. But residency is long, 5 or 6 years, and then you have fellowship. So certainly retention, I think career development while you're in residency is important because you are learning how to operate and take care of patients. But often there's external factors that can influence residents' experience, right? As if you're the only one in your program, if your family kind of understands the training you're undergoing and how difficult it can be. Additionally, how do you work with other members in the hospital, right? Do people think you're not the doctor when you walk in to see a patient or you're in the operating room, right? I think those are all small things that occur in our day-to-day lives, but that really aggregate to a bigger influence on your training. So to recap, we need to improve our recruitment, but I think it's also retention and supporting residents during their training, right? Making sure residents are reported to go to meetings and network, because that's where you'll meet other members in the community. So for instance, at the SUFU meeting, I met Dr. Mariela Martinez, who I believe you know as well. And it was at SUFU. So now we're connected. I know another Latina urologist trainee, right? She's pursuing fellowship, and she sort of guided me on that as well. So it's about bridging partnerships and relationships, within our community.
Yes, I think the peer-to-peer mentoring, it's so important, because that's an additional support that we can have during the process of training. And also even career development, it's completely different for us as Hispanic. It's the resources that other groups have compared to others. So we are used to do with challenges, but I think there is room for improvement. I don't know, Jimena, if you have, what do you think about in terms of the career development, that will help also the retention of not only about residents, but also the faculty.
I think it's very important, because the mentorship is so key, right? You don't know what you don't know, right? You don't know where the connections are made. You don't know where you're going. And you don't really know without having a good mentor what you need to get there. So if you're planning on being chairman, let's say in 10 years, well, there's stuff you need to do right now, so that by the time you're ready to be chairman, you have everything set up. And that's where that mentorship comes into play. And the hard part is that when, so many things are so organic in terms of how you do it. So you tend to gravitate to people that reflect your beliefs, reflect your culture, reflect on how you are. And part of that could be because you're culturally, language, where you grew up, what you're studying, right? So if you're at a generalized meeting, you're probably going to gravitate towards urologist over oncologist, right? Because that's what you have in common. Being a super minority, right? Because urologists are not that many physicians in general. Then you're talking about Hispanics, right? We're not that many. And then are you talking about Latinas specifically? I mean, I always joke, I'm like, there's got to be like 10 of us. It's got to be like 10 Latinas in urology when you start really breaking down the numbers. And then you get used to sort of being the only one, and then you start realizing you don't have a lot of shared experiences, just from growing up and how you interact with your family and how that turns into things that you do and the expectations, and then some of the challenges, So, being an immigrant, we didn't have a lot growing up, right? So I graduated with a big debt. And then kind of sort of how that comes into play, and then how you also kind of sort of helping, support different people, particularly in your family sometimes. That may be the case for other minorities as well, but it may not be the case for other urologists. So you don't have those shared experiences. But the mentorship to make sure that you're thinking about what the next step is, I think is really important, because as you're starting out, you don't know what that next step is, so you don't know what you need to do, but also to make sure that you don't get lost in it, because there could be so many different things that pull you in a direction. I mean, we're dealing a lot with physician burnout right now, but I don't think that's anything that's new to underrepresented minorities, because it's oftentimes you feel like everything about what you're doing is an uphill battle, and then that's why we don't see as many professors and associate professors and chairmen that are underrepresented minorities, because people get lost and don't advance. And it could be mentorship, and it could also be making sure that you have the support to be able to continue, because part of it is not knowing what you need to do, but then the other part is knowing you need to do it, but you need the support to be able to do that.
Yeah, and probably we as a minority, as Hispanics, as you mentioned, we have other challenges. As you mentioned, you have to support others that are by your side. So it's different. So I think one of the purpose of our group is to invest in programs that could diversify the group in urology. So how you can think that the Diversity, Equity, and Inclusion Committee can support Hispanic urologists? I think Gabriela mentioned about the mentoring, and I think there are a lot of space that we can improve.
Yeah, well, recently I saw that there is an organization called the Hispanic Urologists of North America, created by Dr. Maria out of Montefiore.
Mm-hmm.
And I think for me, initially, I saw that. I think what it represented was the opportunity to be able to gather Hispanic urologists within the AUA, within an organization, to be able to, be able for us to network and get to know each other, and really celebrate the diversity within the Hispanic urologists and the advancements we've been able to contribute to urology, and what opportunities we can help each other with as well. And I think that wasn't really there before. Now I think it's going to be able to be more formalized, and I'm optimistic that that organization can grow and help connect us even further, and support our mission of mentorship, and really being celebrated and recognized as what we have to contribute in the field.
Yes, I agree completely, Gabriela. That there is a need to continue this, to be able to do connections with not only between us, but only to extend to us. We need to educate. We need to create a space that we feel safe and we can grow as a person and also as a professional. I think the initiatives in terms of creating education components, like how about microaggressions, like educating everybody, because this is something that it's real. And I think it's very important for not only the urological private community, but also for the academic community that are responsible for the future training of the next generation of urologists, that they are aware of these issues. So, and obviously in that way we can increase the efforts to retain, as you mentioned before, students and faculty. So this is really, really important. So I'm so sorry, Jimena.
I'll say they just kind of following up on Gabriela has said previously. I think working on having those exposures for medical students, for instance, that don't have a home program. Urology is a field that I don't think gets the exposure in medical school as it should. So there's so many people that come to find out about urology so late. And those who don't have a urology program in the institution are at a greater disadvantage because of that. And so we're missing that pool. So to be able to help, provide that exposure, to let people know what urologists do, and not just, because it's not just about what is urology in general, but all the subspecialties. People don't understand the differences and the broad base that urology really has to offer. Being able to create that exposure will be helpful too.
Yes, I agree, Jimena. In my case, for example, I was never exposed to urology. I actually did a rotation in urology by serendipity. I was doing a rotation in head and neck surgery when I was as a fourth year med school, And I remember that in the second week, I was not, that was not connecting with me. I went and then I asked for a change of rotation. And the director told me, you know what? The only thing available at this moment is urology. Do you want to do that? And I said, yes. I need to move from this rotation. I can't. So, and it was so impactful for me, and I enjoy so much. So I decided, I was sure that I was going to do a surgical field, but I was not sure which one. So, but that shouldn't be, I should have more exposure. And I think the earlier you are exposed to the specialty, you can have an impact to other students. So I think it is important to have a pipeline and outreach and try to increase that diversity in trainees in order to make a change. So what do you think other Hispanic urologists will, you want them to know? Gabriela, what do you think as a trainee that you are in the process to become a urologist and we continue having a spectacular career? What do you think or do you want to other Hispanics would like to know about us?
Yeah, great question. Thank you. So I think it's really important, again, with the same concept of forming an organization, with all of us, is making sure we're all connected. And I think that's something that's been lacking within the AUA, to a collective effort among us to support each other and create a network of opportunities, but also to be able to do a phone call, right? For maybe a resident who is interested in a fellowship program or learning more about another institution or looking for a job, creating those network systems that I think we currently don't really have. So I'm soon to graduate, right, and going to look for employment. And I think certain things that will be important is, for example, diversity in the workplace that I'll be in, the population that I'll be taking care of, making sure, that there are Spanish-speaking patients that I can serve as a urologist for. And I think that's where this community support comes into play, because, we're able to reach out to one another and have that guidance. I think that's really important. So I think we all need to focus, on visibility and putting ourselves out there as well, but really working amongst each other to create partnerships, because even though there aren't many of us, I think with the amount of Hispanic urologists that are available, I think we can have a big impact and create infrastructure for more to come, in the years as the numbers, I think, will continue to grow just based on the demographics of the country. So I think that's very important.
I agree with you, Gabriela. And actually what Jimena mentioned earlier, that she was always the only one on the room, I think that it will make an impact. So even though we may feel like we are the only one in the room, there are a lot of others that we can rely on. So we, as part of the AUA's Diversity and Inclusion Committee, we hope that these conversations can drive the future to allow equitable and diverse urological workforce. So I really thank Dr. Cubillos and Dr. Gonzalez for joining in these efforts. I'm really happy that we have been able to connect, and hope that others can connect with us, and obviously with our urological field. So thank you so much.
I want to just expand a little bit on the question that you had just asked, Gabriela, because I think, sometimes people don't necessarily agree with the need to provide a lot of diversity, that they just think that we're doctors, we take care of people, and what difference does it make? But I would say that what we offer to the greater urologic community in that diversity, especially as we're increasing the number of Hispanics in the U.S., is that there is a big cultural difference. And I think sometimes people don't understand that. I'm a pediatric urologist, so I deal with a lot of things, for instance, with circumcision status. And I've had so many patients come in because they're 7 years old and they don't want a circumcision, but they're told they have to have a circumcision. And when I start talking to them, and they come in because, many Hispanic patients are very compliant. So they're like, okay, well, my doctor says, they need to have a circumcision. And I'm like, well, do you want one? And they're like, no. And I'm like, well, there's other things you can do if you have phimosis to manage the foreskin, and they don't need to have this done. And I think just because culturally so many people here are circumcised, for instance, then that being able to understand, like, okay, well, that there are other options and there are things that we can provide, and understand that there's cultural differences in how people may approach medicines. There may be language barriers and things that people may not understand. So I think that we could provide that ability to be able to get adequate healthcare to the broader patient population. So when people are like, why do we care about diversity? I think that's one of those things, so that then you can also maybe even connect a little bit more to your patient population. Maybe there's something that they may not feel comfortable talking to someone that they feel may not understand where they're coming from. When you then come in the room, they're like, great. Or even something, as Gabriela was talking about, something as simple as I can walk in the room and talk to them in Spanish, and they don't need to have an interpreter, a third person to have to talk about something that may be particularly embarrassing for them. So there's definitely a lot that we can contribute to the general health and improvement of the urologic care for our patients.
Definitely, Jimena. And there is expanding evidence that obviously if you have a diverse healthcare system, the health outcomes of the patients are better. It's a given. So I think what we place in the room it's even more important in terms that is not only in terms of support of us as urologists, but also for our patients. So I think that it's a win-win situation. So Gabriela and Jimena, it is well known that the U.S. health system continues to face large racial disparities in healthcare. And these were evident during the COVID pandemic. So therefore, there is a need to identify and mitigate racial inequity. So why do you think it is important to have these conversations?
So I'll start. So I think one big movement that the DEI committee had at last year's AUA was incorporating the plenary sessions for disparities within different urologic fields. I think that's really important because often based on our anecdotal experiences, we might know, right, that there are issues within our community, whether it's delay in care, delayed in presentation, whether that's oncology, or delayed care of incontinence for quality of life measures, or delayed orchiopexies in the pediatric population. But often we may not have the data to present that and have others understand the issues, but we may see it in the day-to-day care that we provide in the clinics or in the hospitals. So I think that's one of the reasons why it's important. Second reason being that there needs to be funding and time supported, either for faculty members to do this kind of work, or within the AUA to have grants specifically for, or augmenting the grants that they already have for investigating disparities within urology. And then additionally, often we identify the disparity with the research, and we may not go all the way to saying, okay, how can we fix this? So I think the first step is always identifying it, but also knowing that research continues and we need to work on interventions to address those disparities. But I think both go hand in hand. Obviously, I think addressing the disparities sometimes it's more difficult, may take more time, and the return on it may not happen until later. But I do think it is important, one, to identify the problem and then also work on solutions as well, with whether it's at your own clinic or your institution, or creating more overarching efforts. I think that's important.
I agree completely, Gabriela. There is a lack of participation in clinical trials for minorities, and even we should do outreach activities. There is obviously there is a huge gap, and if we don't address it, will be never answered. So I think it's a challenge that we as clinicians face, and obviously our patients also. But there is an obvious need that we need to work on it. I think it has been a really a pleasure to be able to be with both of you, Gabriela and Jimena. I'm really proud of being part of this increasing group of Latinas and urologists. And I hope that these conversations drive the future of our community. So thank you so much, really, Dr. Cubillos and Dr. Gonzalez, for joining these efforts.
Thank you.
Thank you.
This has been Voices, an AUA News Inside Tract podcast, and is brought to you by the Diversity, Equity, and Inclusion Committee. For more information about the AUA's diversity, equity, and inclusion efforts, visit auanet.org/diversity.